You're doing your cat-cow wrong and it's giving you back pain, or at the very least, it's making you miss the reason why you have back pain. My name is Dr. Caleb Kaufman. I'm a doctor of physical therapy and I'm the founder of NorCal Physio. I work with a lot of people with low back pain, and a very common trend is that they get this very basic movement incorrect. Now, we don't realize we're doing it incorrectly because this is just what we do. But until someone points it out, we don't know. So as we go through our movement assessment, it's, okay, go through this movement. Do you know you're not doing this and you are doing this? And they just don't understand. It's really interesting because at that moment, it's a light bulb. It's an aha moment that says, oh, wow, I really don't know how to move through my spine and my hips. Because while we think that this is just a spine movement, this is actually a mid-back, a low back, and a hip movement. Once we can get all that together, we can really start to understand why our back continues to hurt, why we don't have good movement control, and start picking out the reasons of why instead of just looking at where that pain is. So I want to show you with the spine what I'm talking about. So this is the spine. You have your cervical spine, your thoracic spine, your lumbar spine. Then you have the sacrum, coccyx, and you have the hips. This is all the pelvis area. So when we're doing a cat-cow, the thought is that we get into global flexion and then global extension. So global flexion is just this. We're bending everything in, right? So that's a nice amount of flexion. Then what we do is we go into global extension, just like this. And what we should see is we should see a nice little curve here throughout the cervical spine, thoracic spine, and the lumbar spine. And then as we go up, it should be a nice gradual curve. Obviously, this isn't moving as well as a normal spine. It's a little stiff, but we should see when we're looking at people that there is this nice little valley and then a nice little rainbow. What happens though is that I don't cue people into how to do this first. I just say, do a cat-cow. When they push their back up, what happens a lot is that this bends a lot, obviously not that much, but this bends a lot and this bends a little. And then on the opposite direction, it's the exact opposite. This moves a lot and this moves a little. And it's really interesting as I point this out to people. Because the first thing is, yeah, why does that matter? But then the second thought, once I explain it, is, oh, wow, that really does matter. Because what happens is that when we look at that global flexion, we find that there's a lot of movement up here. We're really bent into this kyphotic position, and we can't get the lumbar spine out of that extended position. Best we can do is get it to neutral, because a lot of people just don't have this movement. Then as we go the other way, there's a lot of movement at the low back and not much movement here. So now imagine with this. For the person who likes to stand in a kyphotic posture with the pelvis dumped forward, and there's always that extended position here, when they're trying to do that exercise and they're just jamming their back into extension, that's not going to be super comfortable. So for the person who always gets pain in the low back with the cat-cow, maybe don't do this for now. Maybe think about how you can move better throughout all of the segments instead of just banging at that area. But here's the other thing. We want to get the movement into the correct pattern. So how do we do that? What we do is we have to cue that person a little bit differently. So when we're going up into that flexed position, instead of thinking about putting your back to the ceiling, which most people just do this, especially those people who are desk workers, even me sitting right here, I'm hunched forward quite a bit, got to fix my posture. But a lot of times we just like to move through this motion. Instead, what I like to do is I like to say, look, don't worry about how the spine's moving. All I want you to think about is tucking your pelvis underneath. There's two ways you can do that. Guess what? I don't want you to do the way that you think you're doing it. I don't want you to tuck underneath by pulling the abdominal muscles up. What I want you to think about is driving the glute muscles forward to help rotate the pelvis forward. What that's going to do is that's going to initiate the movement from down here, and it's going to help bring that spine into flexion. Okay? So that will clear up that area. Then what I want to do is I want to think about this area. So now as we go into the extension, what I said was this area moves too much and this one doesn't work enough. So what we want to do is as we're going into extension, I really want you to think about puffing out that chest, try to get that movement in there, okay? Just like that. Once we start doing that, you're going to start saying a couple things. Wow, I really don't move well through here. Man, I really moved too much through here. Or when I'm doing that tuck, I just can't feel my glutes work. I can't feel them engage. Those are all actually very positive indicators that we're now doing it right. The body's going to do what you tell it to, but the way it wants to. So that means that as you're moving through your cat-cow, if the body's like, nah, I don't want to do this, I don't want to push through here, the body's going to say, okay, we're going to find out a better way to do it, a different way to do it, an easier way to do it, and it's going to start compensating. Easy is not better, especially when it comes to movements. We don't want to take the path of least resistance all the time. We want to take the best route, the most mechanically sound route. And what I found with this exercise is just how I explained it to you. So we talked about why typically people get that movement wrong. We talked about why that's wrong and a little bit of a correction. Now I want to show you the best way to do that exercise. There's a modification that I like to use that works really well for both of those scenarios. Remember, we want to get that thoracic spine moving better. We want the low back moving less into extension, more into flexion. But now we want to start integrating some of the hip muscles. So the way I like to do this is with a band. You're going to grab the band just like this, put it underneath your armpits and around your body, not like that, just like this. Then you're going to come into that cat-cow position. Oops. Now what I want you to do, the band should be pulling down at your spine. We're going to go into the extension version first. So all we're going to do is let that band pull us down, really feel that stretch in the mid-back, and look up, puff out the chest. Take a deep breath in and out. As you breathe out, just try to let that chest drop down. What you should feel is you should feel a little bit of discomfort in that mid-back. What I feel is a little pinchy stretch. And that's actually really good. That's where I want to feel it. I don't want to feel that low back moving too much if that mid-back isn't moving as much as it should. Then what we're going to do is we're going to go into that flex position, that global flexion position. So a lot of times we just do this motion, but that really doesn't help the glutes and that doesn't help the low back. So instead what we're going to do is we're going to drive the hips forward using the glutes, try to get the stretch in the low back, just like that. And then we're going to drop down into extension and then go into flexion. So as you notice, my hips are staying relatively above my knees. What I don't want to see is this movement, because that's not really doing what we want. We want the hips to stay still. We want the pelvis to rotate around the hips, just like that. So now the question is, who should do this exercise? Who should not do this exercise? If you have considerable low back pain, that's a 9 or 10 out of 10 pain, you probably shouldn't do this exercise. You probably should get an assessment, try to figure out what is causing that pain. Maybe you need some prednisone or pain medication or something to take the edge off so you can start moving again. So this probably isn't for the person who has significant severe pain. This is for the person who has some nagging low back pain, wants to try something on their own, and is okay with self-assessment. It's going to be hard to self-assess, so grab a friend, grab a stretching buddy, and say, let's look at the cat-cow, see if there's anything wrong. Make sure that you're moving through the right motion. It is for the person who wants to move their spine a little bit better. It's not for the person who is intolerant to these movements. If you're always going through these motions and you're banging into pain and the pain just gets worse and worse, obviously don't do it. But if you're the type of person who can go through this movement, is able to feel those glutes engaged, that low back moving a little bit better into flexion, the upper back moving better into extension, and if you have that good feedback, and if you have a band, and if you have the capacity to do this exercise, then go ahead and give it a shot. Reminder, though, that more is not better. There's all these videos and all these resources on Instagram and YouTube, and I, probably you, have a tendency to grab and pick and pull at everything. This is cool, this is cool, this is cool, this is cool. That scattered approach is not actually going to be helpful for you. We want strategic. We want to have a direction. We want to have guidance. So if you have low back pain, make sure you have a guide who can help you direct you down that path. So give this exercise a shot. If you have questions, reach out, let us know. This is a great modification for the cat-cow. It's a great way to assess your movements. Remember, the cat-cow or any movement is great. We love all movement, but we want to make sure that it is the best for you. This modification is going to see if that movement pattern is the best for you.